In later chapters of life, many people begin to feel caught between two worlds. On one side is modern medicine with its scans, prescriptions, and specialists. On the other hand is traditional medicine passed down through families and cultures, built on plants, routines, and lived experience. Elders often hear these two worlds described as opposites, even enemies. One is said to be scientific and real, the other natural but outdated. Yet, this framing creates confusion, not clarity. The real question is not which system is right, but what each one is actually designed to do. Near the end of this discussion, I will explain the single misunderstanding that has caused so much unnecessary conflict between traditional and modern medicine, especially for older adults. To understand this properly, we must begin with how the body itself works. The human body is a self-regulating system. Medical experts agree that most of the body's work happens automatically. The heart beats without instruction, the lungs breathe without permission. The immune system constantly monitors, learns, and adapts. Healing is not something medicine performs on the body. Healing is something the body does with or without assistance. Medicine, in any form, interacts with this process. It can support it, interrupt it, or redirect it. This distinction is critical, and we will return to it later. Modern medicine developed primarily to address acute problems, infections that would once have been fatal, injuries that required surgical repair, conditions where immediate intervention meant survival. Antibiotics, anesthesia, imaging, and emergency care have saved countless lives. For elders, modern medicine plays an essential role in managing trauma, advanced disease, and life-threatening events. This is not in dispute, but modern medicine was never designed to teach the body how to live well over decades. That responsibility lies elsewhere. We are not yet at the heart of the issue, but we are getting closer. Traditional medicine, by contrast, emerged from long observation of daily life. It developed in environments where people lived with their bodies across entire lifespans, not just during crisis. Traditional systems paid attention to digestion, sleep, movement, seasons, emotions, and aging itself. They were less concerned with naming diseases and more concerned with maintaining balance. This does not mean traditional medicine was always correct or that it can replace modern care. It means it was asking a different question. Instead of, how do we stop this now? It asked, how do we keep the body from reaching this point? Keep that difference in mind because it explains much of the confusion elders experience today. As people age, the body changes in predictable ways. Inflammation increases, recovery slows, reserves shrink, the margin for error becomes smaller. Modern medicine often responds to these changes by isolating symptoms. A pill for blood pressure, a pill for sleep, a pill for pain, each may be appropriate, even necessary. But when viewed in isolation, the deeper pattern is missed. Traditional systems recognized aging itself as a phase requiring different rhythms, foods, and expectations. This is not about rejecting medicine, it is about understanding context. We will return to why context matters so much near the end of this video. A common myth is that traditional medicine is weak or slow, while modern medicine is strong and effective. In reality, they operate on different timescales. Modern medicine is powerful in moments of crisis. Traditional practices work slowly, influencing daily signals the body receives. Herbs, fermented foods, breathing practices, and seasonal routines were never meant to overpower disease. They were meant to support digestion, circulation, nervous system balance, and recovery capacity. These are not cures, they are conditions, and conditions determine outcomes far more than most people realize. Another misunderstanding is that elders must choose one system over the other. This false choice creates fear. Traditional knowledge was never anti-intervention. In many cultures, healers referred people to surgeons or emergency care when necessary. Likewise, modern physicians increasingly acknowledge the importance of lifestyle, stress, sleep, and diet. The conflict exists more in conversation than in biology. The body itself does not recognize these categories, it only recognizes signal. We are approaching the central insight now. As modern life accelerated, medicine followed suit. Appointments became shorter, symptoms were prioritized over stories. Elders often feel unheard, not because doctors lack skill, but because the system is optimized for efficiency, not continuity. Traditional systems placed great value on listening, observing, and long-term relationships. This did not make them more accurate in every case, but it did make them better at recognizing gradual shifts because they became crises. Prevention was not a program, it was a way of life. Now, we arrive at the most important truth, the one this entire discussion has been leading towards. Modern medicine and traditional medicine are not opposing systems. They are designed to operate at different stages of the same process. Modern medicine intervenes when the body has lost the ability to self-correct. Traditional medicine works when the body still has that capacity. Problems arise when one is asked to do the job of the other. This is the misunderstanding that causes harm. When modern medicine is used alone to manage long-term aging without attention to daily regulation, elders accumulate medications without restoring resilience. When traditional practices are used alone to address advanced disease, people delay necessary care. The body needs both applied at the right time for the right purpose. Traditional methods help preserve the body's self-regulating intelligence. Modern medicine steps in when that intelligence is overwhelmed. When elders understand this, the confusion lifts. Herbs are not alternatives to surgery. Surgery is not a substitute for daily care. One stabilizes, the other sustains. Traditional routines create the conditions for recovery. Modern interventions rescue when conditions have already failed. A long life is supported not by choosing sides, but by sequencing support wisely. As we conclude, remember this: the body is not a battlefield between old and new medicine. It is a living system responding to signals over time. Medical experts agree that outcomes improve when treatment is paired with lifestyle support. Traditional wisdom reminds us that how we live daily determines how often we need intervention. This perspective is offered for education and reflection, not as a replacement for professional medical advice. Always consult qualified healthcare providers for diagnosis and treatment. If this understanding brought clarity, let it change how you view care. The future of elder health does not belong to one system alone. It belongs to those who understand when to support, when to intervene, and when to allow the body to do what it has always known how to do.